Hi, my microphone prototype AJ21 is down for the count. It's in the shop and will be fixed soon. In the meantime, I have prototype AJ10 ready to help me out here. Okay, here we go. I have not had access at work to all of my medical journals, and so now that we're slowly getting access to certain publications again and journals and so forth that I have at work, I'm able to get a little caught up. And I came across this article today that I found fascinating, and I hope that you have time to listen to my video so that you too can understand something that I've seen going around in the community that people are asking about, and I think it's of importance to us all. There's no question that glucagon-like peptide 1, GLP-1 agonists represent a major advance in the treatment of obesity for patients with or without diabetes. But studies have shown that once people stop taking these drugs, either by choice, because of shortage or lack of access, they regain most, if not all, the weight they lost. Then there's the fact that those who continue on the drug eventually reach a plateau, at which point the body seemingly stubbornly refuses to lose more weight. In the simplest terms, a plateau occurs because the body becomes more and more used to the weight loss intervention. Dr. Fatima Cody is an obesity medicine physician at Massachusetts General Hospital, and she's also the associate professor at Harvard Medical School in Boston. She stated, essentially, it stabilizes at its set point. Every study of weight loss drugs done over the past 40 years or so shows a plateau. If you look at the phentermine topiramate studies, there's a plateau. If you look at the ibuprofen naltrexone studies, there's a plateau. Or if you look at bariatric surgery, there's a plateau. And it's the same for the newer GLP-1 drugs. The reason? It really depends on where the body gets to. The body knows what it needs to do to maintain itself, and the brain knows where it's supposed to be. And when you lose weight and you reach what you feel is a lower set point, the body resists. When the body goes below its set point, the hunger hormone ghrelin, which is housed in the brain, gets reactivated and gradually starts to reemerge. GLP-1, which is housed in the distal portion of the small intestine and in the colon, also starts to reemerge over time. It becomes kind of a tug of war between the body and whatever weight loss strategy is being implemented. From drugs to surgery to lifestyle changes, we all start to notice changes in how our bodies are responding. Usually, they'll say they don't feel like the treatment is working the same, but the treatment is working the same as it's always been working, except our bodies are now acclimated to it. With an obesity treatment, you reach a point at which your metabolic rate and your daily caloric requirements become equal, and you stop losing weight. Even though your daily caloric requirement is less than it was when your weight was higher. How do we manage the plateau? Several strategies can be used to help patients break through a plateau. From a clinical standpoint, one is to try multiple weight loss agents with different targets. I previously asked my PCP about this, and he said absolutely not. But that was more than 4 months ago, so his opinion may have changed since then, especially with how fast medicine advances. It's being revealed more and more. Patients who are on a GLP-1 drug plus another medication, they're usually on 3, 4, or 5 drugs, similar to what one would see with resistant hypertension. I'm on 2 blood pressure meds and a cholesterol medication. So, me, for instance, I felt so much better from the drug-related weight loss that I began to do things that have helped enhance my weight loss. I started exercising. I gave up sweets and overly processed foods. This points to another element that can help patients break through a plateau over time, namely behavioral health. The more people lose weight, the more they feel better about themselves, and that may mean that they take better care of themselves. The psychological part of this journey is as important as anything else. Not everyone has the same response to these agents, and there are all sorts of issues behind why people are overweight that physicians cannot ignore. So, in addition to managing the drugs and lifestyle, it's important to make sure that people assess the behavioral health help they need, and that once they break through a plateau, they don't develop an eating disorder or go to the opposite extreme and become too thin. This has happened with some people. Doctors are being reminded that they're not just giving patients a miraculous weight loss. They're helping them to become healthier mentally as well as physically. I hope this helps to understand what a plateau is, and hopefully, if we look more into it, what the set point is, we can determine how to break the plateau and how to continue on with this journey and succeed, because we are going to succeed. Okay, let's crush our goals.